In this video, we will discuss the important anatomy associated with the two menisci of the knee. The meniscus is a cushioned structure made of cartilage which fits within the knee joint between the femur and the tibia. There are two menisci inside the knee joint, the medial meniscus and the lateral meniscus. The two menisci function as shock absorbers and provide an important role in maintaining joint congruity and stability. The medial meniscus is C-shaped and the lateral meniscus is more circular. The medial meniscus covers 50% of the medial tibial plateau, and the lateral meniscus covers 70% of the lateral tibial plateau. When you look at the medial meniscus, the anterior and the posterior horns are separated from each other and from the anterior cruciate ligament. The posterior horn of the medial meniscus is the most important secondary restraint to anterior translation of the tibia. The anterior and posterior horns of the lateral meniscus are closer to each other and near the insertion of the anterior cruciate ligament. The transverse intermeniscal ligament connects the anterior horns of the lateral and medial menisci. The meniscus fibrocartilaginous tissue contains mainly water, 72%, collagens, 22%, and glycosaminoglycans, 0.8%, 1 and 2. Type 1 collagen accounts for over 90% of the total collagen content. The meniscus's collagen, glycosaminoglycans, and proteins work together to give the meniscus its ability to resist compressive loads, deform semi-elastically, and lubricate. The meniscus provides load sharing across the knee by increasing the contact area and decreasing the contact stress. The meniscus helps to protect the knee joint, allowing the bones to slide freely on each other. However, the meniscus limits flexion and extension extremes. The meniscus transmits 50 degrees of force in extension and 90 degrees of force in flexion. Beyond 90 degrees, most of the force is transmitted to the posterior horn of the meniscus. Flexion of the knee causes pain. The blood supply of the medial and lateral menisci originates from the medial and lateral inferior genicular arteries. The medial inferior genicular and the lateral inferior genicular arteries supply approximately 20 to 30% of the meniscus peripheral area with blood supply. Approximately 75% of the meniscus is avascular. The peripheral 1/3 of the meniscus is vascular. The inner 1/3 of the meniscus is not vascular and is nourished by synovial fluid. The middle third is the red/white zone, and it is avascular. The medial and lateral inferior genicular arteries also supply the infrapatellar fat pad and the patellar tendon. The meniscus appears triangular in a cross-section. The most important zone is the red zone. Tear of the meniscus will heal in that location. The peripheral portion of the meniscus has nerve supply. It is well innervated in the posterior horn of the meniscus, and it provides proprioception during joint movement. When the meniscus is injured, there is usually a history of a twisting injury, and the patient will have pain on either the medial or lateral side of the knee. When the patient is examined, there may be some effusion. However, the most important finding will be the presence of tenderness along the medial and lateral joint line that should be suspected as occurring due to a meniscal tear. The McMurray test is the most commonly used physical exam to diagnose meniscal tears. To test for injury to the medial meniscus, bend the knee and externally rotate the ankle, which externally rotates the tibia. Next, bring the knee into full extension. The test is considered positive if a palpable click is felt or there is pain at the joint line. To test for injury to the lateral meniscus, bring the knee back into flexion and then internally rotate the knee. Next, bring the knee into full extension. The test is considered positive if a palpable click is felt or there is pain at the joint line. Thank you for watching this video. This concludes our video on important anatomy associated with the two menisci of the knee. We will discuss other important anatomical structures of the knee in additional videos.